So I'm joined today by Jamie Sprague, who's going to talk to me about the public Narcan training that we're hosting here at the library on Tuesday, January 7th, starting at 6:30. Jamie, thanks so much for joining me and talking to me today.
No problem. How are you?
I'm good. How are you?
Good, thanks.
Good. Happy winter.
Happy winter.
So we're going to be talking about Narcan at this program. I guess I should start to say I'm super excited. I know that you're here representing your work with Mannett Community Health Center.
Yes.
We also have the Quincy Health Department is co-sponsoring this with us. How long have you been working at Mannett?
For about 2 years now.
Okay. And you're studying public health, I know we were talking about a minute ago.
Yep, I'm working on my master's in public health, studied health science in my bachelor's degree.
Okay.
Moved to Massachusetts and started at Mannett, and I've been here ever since.
Wow.
Yep.
What kind of work do you do at Mannett?
So I work with the outreach team. We do a lot of prevention and screening. So we work with a lot of folks who are community members who are at risk for HIV, hepatitis C, STIs, and overdose. And we work on working with them to improve their health, get them into medical care, and get them whatever health assistance they need.
And do you work with just anybody on the street? Is this something that anybody, regardless of their income, can take advantage of? Who are the kind of the key people that you're usually working with? Yeah,
we have a lot of free programs through our team. We provide free Narcan to anybody who's not able to access it at the pharmacy. We are able to provide STI testing and all sorts of different resources to people who use drugs, people who don't have access to medical care, things like that. And we're also able to refer into different treatments around the area, as well as into our medical center for primary care, medication-assisted treatment, HIV, Hep C treatment, things like that.
That's a lot of different services that you provide.
We wear a lot of hats.
How many folks do you usually see in a week?
In a week?
Yeah, do you think, or should we talk about a day or an hour?
It really depends on what's going on. So we do a lot of street outreach where we just go around and talk to people on the street and see how we can work with them. So we could see anywhere from 5 to 20 people in a day doing that. We also go to a lot of the local drug treatment centers, down to Father Bill's, a lot of different places to speak with large groups of people. So we do see a lot of people.
That's really powerful work. Thank you for doing that. I imagine that some people would think it's kind of scary doing this kind of work. Does that ever cross your mind? Do you ever fear, do you feel afraid, or how do you feel about doing the work?
I think the scariest thing is just getting over the anxiety of talking to a person on the street that doesn't know me.
Just the stranger, that makes sense.
Yeah, exactly. But I never fear for my safety. We're very safe in what we do, and it's a really supportive community. So
that's great, and I'm sure you meet a lot of really nice people. It's amazing when you talk to people. You get surprised by kindness more often than not.
Absolutely.
Yeah. That's really awesome. Now, you mentioned Narcan is one of the things that you give away to free for anybody who can't get it at the pharmacy.
Yes.
People should know that they can get it at the pharmacy, though. If they have a prescription drug plan or something, anybody can walk up to a pharmacist to their pharmacy and just ask for it. Is that...
Yeah. So you can get a prescription for your doctor for Narcan and be able to pick it up at the pharmacy, but you don't need a prescription. You can just walk up to any pharmacy in Massachusetts, and they should be able to provide you with Narcan.
That's really good to know.
Yeah, most insurances will cover it. And depending on your medication copay. If your insurance doesn't cover it, though, you can always give us a call and we can figure out how to get it for you.
So we're talking as if everybody knows what Narcan is, and saying that we're doing a public Narcan training assumes, again, that people know why you would want to get trained in Narcan. But maybe we should back it up a little bit.
Yeah.
What is Narcan?
So Narcan is, it comes in many forms, but the most common form is a nasal spray that reverses the effects of an opiate overdose.
Okay, so if somebody is overdosing because of opiates, which could be either something that they shot up or some pills they took, it really doesn't matter how they took it in.
Correct.
And you said it's a nasal spray. Is the form and there's other forms too?
Yeah, there are some intermuscular forms. There was an older nasal spray that you had to assemble, but we don't see that as much anymore.
Okay.
But the Narcan that's given most often to just people like you and me, and people who are using drugs or have loved ones who use drugs are typically the nasal spray. I actually have one with me.
Oh, okay.
Looks like this.
That's really handy. So that even fits in a pocket if you need to.
Yeah. In your purse and your pocket, backpack, wherever.
Yep.
Don't leave it in your car, though. where it'll freeze.
Okay. So you don't want it to freeze.
Yeah.
And maybe you want to keep it in a bag or something instead of in your pocket because it probably doesn't want to get too hot either.
Yeah, but stored at about room temperature.
Room temperature? Mm-hmm. That's cool.
Yeah, but we'll get more into that
Of course, at the training. But I don't think it's very complicated. How long does it usually take to train somebody?
Our training will probably last, 30, 40 minutes. Yeah, it's pretty quick.
So it's not like the master's program that you're going through. It's not hours and hours of courses.
Yeah, it's very easy. You should walk out of it feeling like very confident that you can use it. We have little example ones you can try out. And we'll go over a lot of the different, laws associated with it, what puts someone at higher risk for overdose, how to store it, where to find it, how
Everything
to get more
you need to know.
Yeah.
And I understand that I've seen some reports recently that deaths by overdose are statistically dropping in the state, which is really exciting. And I think people are attributing that to the accessibility, the availability of Narcan. Is that how you read things too?
I would hope so. Yeah. I mean, it's much more widespread nowadays. It's a lot easier to get than it used to be.
Yeah.
And it's becoming very commonplace, similar to how, bringing sunscreen along or bringing an EpiPen along. People are bringing Narcan along wherever they go now as well.
Because you can save a life with it.
Correct.
Yeah. And I know it's really important when we talk about Narcan. One of the concerns when I've talked with folks is it's not just administering Narcan, and I know you'll cover this in the training, but it's always important to seek attention if you ever get to a spot where you need to use Narcan. If somebody's out and they're revived, you can't just stop with the Narcan. You really need to get additional help because the possibility to fall back into an overdose situation, you're kind of right there. You're on the precipice of life and death, really.
Yeah, Narcan only lasts for 30 to 90 minutes. So
okay, so you got a window.
Exactly. You have a window. The Narcan's going to help restore breathing and bring the person back conscious again, but that doesn't mean they might not fall back into that overdose. So it's really important for somebody to seek medical care after they've
calling
been given
911 or going directly to an emergency room.
Correct.
Yeah. Okay.
Mm-hmm.
Well, I don't want to mislead anybody, so
yeah.
we don't have a miracle. We can't.
Yes.
But it's a Band-Aid to get you over.
Right.
Yeah.
To save those precious moments where somebody
Right.
might not normally be breathing.
Yeah.
To help them out until they can get into the hospital.
That's great.
Mm-hmm.
And I know all the other services that you offer and many other resources here in the city of Quincy also help people once they've recovered from an overdose situation, find ways if they're interested in pursuing them so that they can, find a better way and not be in that, risky, have that kind of risky behavior again.
Yeah. Quincy is a great place for that. There's tons of resources, whether somebody wants to go into like acute inpatient treatment. There's lots of places around here that can do that. There's outpatient treatment with counseling. There's medication-assisted treatment with, Vivitrol, Suboxone, or Methadone, all of which you can access in this area. And we can help refer people to. So if anyone's having any issues getting into treatment or knowing what their options are, they can always come talk to one of our outreach workers about it.
And there's no one magic trick that works for everybody.
No.
I mean, Narcan works for everybody that's overdosing, but beyond that, there's a lot of different resources available, and you can help people figure out what might work best for them.
Yeah, exactly. Everyone's path is different,
Yeah.
and just because one thing worked for somebody doesn't mean it's gonna, be the treatment for other people. If you have, let's say, heart disease, like the pill that you take might not work for your neighbor.
Yeah.
Similar with substance use disorder.
And I know, especially with some of the counseling, there's some of the programs I know from talking to people in recovery processes that you can also pick and choose. There's some, just because this part works for you, maybe this other part works for me.
Right.
And there's no judgment. As long as we are caring for each other and living healthy lives, that's all we can hope for, right?
Yeah, exactly.
Cool.
Hit the nail on the head.
Right on. Well, thank you so much for coming and talking to me today, and I'm really excited for the training that's happening.
Yeah.
Is there anything else that people need to know before we just encourage people to come to the training?
Just come with an open mind, be ready to get trained, be ready to probably have a few laughs because, it's a serious topic, but we try to keep it light. But you should feel pretty good using Narcan by the time you leave.
Awesome. Thank you, Jamie. This is great. I'm so glad that you're able to come and do this training for us.
Yeah, thank you for having me.
Great. Please come out and learn how you can be prepared to save a life and prevent a fatal overdose at our public Narcan training happening on Tuesday evening, January 7th at 6:30.